Hi guys, Ryan Marshall here, Australian podiatrist with East Coast Podiatry in Singapore. Today we're going to be talking about a condition called Sever's disease, otherwise known as Calcaneal Apophysitis, which is the most common cause of heel pain in children. Now, first of all, what is Sever's disease? So the condition is a bone injury in which the growth plate at the lower part of the heel becomes inflamed and painful. Now, what causes this condition? So as the bones are growing at a quicker rate than the tendons and the muscles, there is force that is placed throughout the Achilles tendon. Now, over time, that repetitive stress results in damage to the growth plate, which brings about the inflammation and then the associated pain. Now, who's at a risk of developing Sever's disease? So Sever's disease is most commonly seen in children that are doing a lot of sporting activities. So with that, it occurs in periods of growth spurts, which is seen in adolescence. In females, the most common age to see Sever's disease is between the ages of 8 to 13 years, and in males is 10 to 15 years of age. As the growth plate closes and the bone hardens, the symptoms are not apparent, which is why it's not often seen in older teenagers or adolescents. So, what are the symptoms of Sever's disease? So, Sever's disease will be seen as pain localized to the back of either one or both heels. We are usually seeing patients report of pain during and post activity, which means they are normally not able to walk or they have a limp. We also see pain upon first weight bearing in the morning with stiffness within the ankles, and quite often we can see redness and swelling localized to the heel. So what's involved in the diagnosis of Sever's disease? When attending to a podiatrist, the podiatrist will obtain a clinical history as well as perform a physical examination. We also use diagnostic ultrasound to confirm the diagnosis as well as rule out any other conditions. Now, once we have an accurate diagnosis, we are then able to formulate a treatment plan for the child. So that means it can be treated conservatively without the need for surgical intervention. We initially address the patient's activity levels and then also address strengthening as well as stretching activities of the soft tissue structures. We also need to address the child's biomechanics. The way that we do that is through the use of a customized foot orthotic to reduce the repetitive force that is placed on the growth plate. What we focus on in clinic is being able to reduce the patient's pain levels and return them to their activities as quick as possible. The way that we are able to do that non-invasively in clinic is through the use of extracorporeal magnetic transduction therapy, or more simply, EMTT. The biggest benefit of EMTT is that it is a painless treatment, but then allows us to reduce the symptoms, which is of course the pain, the inflammation, and the swelling. When treating Sever's disease, our main goal of treatment is to manage the pain as well as reduce any further injury. With that, it is very successful in reducing the symptoms for patients. As we are addressing these symptoms, it means that patients are then able to return to performing their activities, but at this point, pain-free. If your child has been experiencing any pain at one or both of the heels during or post activity, I would suggest to make an appointment with your podiatrist to have it assessed, and then we can formulate a management plan from there. Thank you guys very much for listening today, and I'm looking forward to speaking and seeing you soon. Take care.
For more information on related conditions, check out our other videos.